Hi everyone on Facebook. I'm just going live on Instagram, so give me 1 second. Hello everyone on Instagram. So I'm live here on Instagram and Facebook. If you guys have any questions during the stream, just send me a private message or comment below and I will definitely make sure I answer it after the stream if I can't answer it now. If you are watching, just give me a wave or a heart or a hello. Let me know you can hear me okay. Just let me know you're there. So today's talk, we're going to be talking about the C-section shelf. Does anyone know what that is? I know I posted it the other day on my Instagram, and a bunch of people said, yes, I can't get rid of that. And others were like, what the heck is that? They had no idea what that was. They've never heard of it. It's something I see come up all the time in some of the cesarean healing groups that I'm in on Facebook and that I'm asked about by patients often. And it's called the C-section shelf. There's other names for it too, but I think that one is kind of like the best description. It's basically underneath your cesarean scar. It's very tight, the skin above your pubic bone. So if you look at my little pelvis here, so you have your pubic bone here, and right above is our cesarean scar, and it's going to be like very tight. And then above that, the skin just kind of like, and maybe belly fat just kind of like hangs over it. So it's almost like a shelf because it's so tight under, and then everything else just hangs over. Sometimes if you have a lot of belly fat or a lot of extra skin, you can't even see your scar when you're standing in the mirror looking at yourself. Others, they don't have that. They can see their scar very clearly and it's healed very nicely, and they've maybe been doing their own massage, whatever it is, and they don't have it. But for those of us, because I do have it, that have the extra belly fat or the extra skin that hangs over the scar, that is known as a C-section shelf. If you're watching and you've had a cesarean, and if there's any other names you know of that you want to throw out there, let me know, because I'm always interested to learn new things. So some people are a little bit confused about what it is because they actually have the mommy pooch. And what that is basically, it's like in the middle of your stomach. It's just like not extra skin or belly fat, but it actually feels like a bulge. And what that usually is, you'll see it a lot in women who look a lot smaller and then still have a big belly, or if they are medium-sized or larger women, but their stomach kind of protrudes out in the middle, almost making it look like they're still pregnant. I'm sure some of them have even had people ask, oh, when are you expecting? And you're like, I had a baby a year ago, thanks. So that pooch in the middle is actually usually caused, not all the time, but it can usually be caused by something called diastasis rectus abdominis, DRA. And it's actually, our abs separate when we're pregnant. So I'm pregnant right now and I have definitely like quite a big space between my abs. I can feel it. And it's because it's making room for your growing belly. And so sometimes in postpartum, our abs aren't coming back together as nicely or as quickly as we want them to. Sometimes we need to go and see a pelvic physiotherapist and do specific exercises to help rebuild our core muscles, to help bring those abs back together and give us that internal abdominal strength again. So that's usually what that pooch is. It's more kind of like in the middle. Sometimes it can be in the lower, below the belly button and above. But in regards to cesarean, a lot of times we're talking about the shelf. We're talking about more of like the skin or the belly fat that's hanging over the scar. Sometimes you can have both. And that's definitely very common as well. So that's kind of what it is. What is causing the shelf? There's a couple of factors here. First, we have to look at the person's actual body composition. So if someone has a lot of extra abdominal tissue, a lot of skin that's just kind of hanging and looks kind of like very stretchy still, that's usually more of like genetic. Like you may not be able to do a lot about that. That your skin just hasn't been as elastic to kind of bounce back and kind of come back to its normal state. Once it's stretched, it's kind of stretched out. And then the other side of things is if you have put on weight, or you do have a lot of adipose, which is fat tissue in your belly, that could be leading to you looking like you have this belly shelf, this C-section shelf. So definitely diet and exercise will help with that. More so diet. Belly fat's usually brought on by stress, but also like sugars and carbs and stuff like that. So speaking to a dietitian or a nutritionist may help with those things. You want to look at also fascial restrictions. So when you have fascial restrictions around your scar, not only is your tissue, hi Daniela, not only is your tissue not going to be able to be as flexible as it was before, there's going to be a lot of restrictions. And when we talk about, again, I say this every week, the cesarean scar, we're not talking just about the outside scar, what the scar looks like. We're actually talking about what's under the scar, which is all those layers of tissues, right? Again, we have the skin, we have the fascia, we have the fats, we have the muscles, we have the uterus, and we have all the tissue in between all of that. And so when we're talking about fascial restrictions, we're talking about the fascia underneath all of those layers and in between that have scar tissue and adhesions that can cause them to almost be like glued together. So if we help to try to loosen some of that up and free up some of those layers of our abdomen to allow for better range of motion, you may actually see less of the shelf happening and less of that tightness around the scar. You may not even have like a full shelf. You may even have a scar that is like puckered in at certain sections. And that's definitely an indication you need to get it worked on by a massage therapist or a physiotherapist or a manual therapist who does massage, or even learn it yourself, right? So another thing too to take into account is your posture, because a lot of us after having babies tend to not stand or sit with good posture. Actually, I think a lot of us don't sit with good posture in general, right? Because we're all kind of slouching and everything. So you want to make sure that after you've had a baby and you're sitting, that you're not obviously slouching your upper body, but you want to focus on your pelvis. This is something I talk about all the time. So again, here's my pelvic model. Okay, this is the side of our pelvis. So when we're pregnant, we actually go into a lot of times more of a lordotic curve. So your spine comes up from here. And the lordotic curve is like a curve that kind of goes like this. So it gives you that sway back. And you actually want to picture sticking at your tail. So this is your tail, your tailbone. And you want to picture sticking that out. So when we're sitting and standing in postpartum, a lot of times after we've lost that baby and that extra weight at the front, we tend to slouch. So we're slouched forward because we're holding babies, we're feeding. A lot of times it's just this kind of like upper back rolling forward, and your pelvis is kind of tucked in as well. So you're tucking in your tailbone instead of sticking it out. And some of that can lead to the look of your C-section shelf being greater than what it is. So we want to first focus on better posture, because it's better for your pelvic health and it's better for your whole entire body, but it would also make your body look better. So you want to untuck your tailbone and focus sitting more on your sits bones. So if you're sitting in a chair, rock side to side, you'll feel your sits bones, and then rock front to back. You'll feel your pubic bone at the front and your tailbone at the back. So you want to sit a little bit more on the front. If any of this causes pain or discomfort, go see a pelvic physio, get assessed, see if there's any underlying conditions happening. You don't have to have had a baby to have pelvic floor dysfunction, but you shouldn't have pain rolling onto the front of your pelvis, especially after a cesarean or after a vaginal delivery and it's been 12 weeks. You definitely want to be able to move freely in a seated position. So to help with the look and to have better posture in that area, roll onto more of the front of your pelvis, okay? I say sit on your vagina. That's what I tell my patients. Don't sit on your tailbone. Sit on your vagina. Sit more on the front, okay? For any of you who are just joining us, we're talking about the C-section shelf. If you've had a cesarean and you know what that is, give me a wave or a like If you have another term for it that you call it, if you have one and you don't even know what to do with it, I'm definitely here to talk about it and here to help, because there is ways that we can help improve it. Maybe not always get rid of it fully, but we definitely want to know that there's a way that we can relieve the symptoms somehow. So posture is really important. Again, when you're standing too, I know you hold your baby and you're kind of tucked in, untuck that pelvis and have better pelvic posture. That will make a big difference. The diaphragm is also another one. If you don't know what the diaphragm is, I apologize. I'm so out of breath because I'm 34 weeks pregnant and I'm just like talking a lot. I feel like I'm running out of breath. Anyways, so the diaphragm, it sits up into our, I can lower this guy a little bit. Our diaphragm sits just below our rib cage. I'll stand a little bit. It sits in our rib cage, kind of like this, like a dome. And basically when you breathe in, it pushes down towards the pelvic floor, and your ribs help come out this way laterally to help to give you more space when you're breathing, so that your ribs can expand or your lungs can expand to fill with air. So when it does that, it actually creates a downward pressure. Now, if your diaphragm is tight or kind of stuck and it's not doing that full contraction. So when you think about a muscle contraction, any muscle in your body, and you think about if you're doing a bicep curl, think about a tight muscle as you're already here and then you're flexing, okay? Instead of being lengthened and then flexing. So if you have a tight diaphragm, it's doing this, okay? And that can cause a lot of issues with the way that your core muscles and your pelvic floor are all working together. It's also going to create a bit of a downward pressure on your pelvis, which can also lead to the look of your C-section shelf being worse. So releasing your diaphragm can be done by a massage therapist, or if you go to another type of practitioner, talk to them about your diaphragm, get them to assess it and see if there's any restrictions in there that they can help with, because that can help as well. If you're going to do any type of work with your C-section shelf, you want to wait at least 12 weeks postpartum. There's still a lot of swelling and a lot of inflammation happening in the tissue. Could be holding in some fluid around your C-section scar in those first, I would even say 6 months. So you definitely don't want to be doing any direct work around that area until you're at least 12 weeks, I would say, just due to the fact that it may be tender, and you may still be healing within the layers of your scar. Another thing that people go for is the abdominoplasty, and basically it's surgery. If that is something that interests you, you can talk about it to your doctor. It's important that we all feel good in our bodies. And I know sometimes that is the only way. People have tried everything. And what happens is they go to see a plastic surgeon, and underneath the skin, they take a tool to kind of help separate the connective tissue from the scar, which then takes away that kind of tightness around the C-section scar. If that's something that interests you, definitely go talk to a health practitioner about that. But if you're looking for like a non-surgical route, these are some of the things that I feel can help. I've done it in my practice, and I've seen a huge change with patients that are even like 40 years postpartum. Another one to look at is just accepting and loving your body and yourself, and stop trying to change everything about your body. I was telling my pelvic physio today, low rise jeans are out of style. So we don't have to worry about that anymore. High-waisted pants are totally in style. And it's something we can use to help cover up our shelf, and learning how to love and accept our bodies for what they are in postpartum, whether you have extra tissue, extra skin, extra belly fat. These are all things that come with having a baby, having a body that goes through such a transformation within 9 months, and then expels this baby and now is in recovery, and just learning to love it and learning to just embrace it instead of hating it and being disgusted by it. Majority of the time, our partners don't care. As long as we're confident and love ourselves, that's really what's most important here. So learning how to accept your body too, I think, is a big thing. If you don't feel good about your body postpartum, go seek the help of nutritionists or trainers or support groups, because a lot of us feel that way after. You're so cute when you're pregnant, you have this belly, and then you have a baby and you're like, what the hell is this? So it's very common. You're not alone to feel not good about your body after giving birth. But definitely, if perspective, you can change your perspective and have another outlook for what, your body looks like now and what it's done. Maybe it will help you just feel better about it overall. But definitely contact your local massage therapist or physio, pelvic physio, and get these areas worked on to see as a team if they can help to restore the tissue and make it less visual of an issue. And if you are having any symptoms of pelvic floor dysfunction or any pain around your scar or any pain with different parts of your lower back, these can all be related to the scar and definitely need to be addressed sooner than later. If you have any questions, please feel free to reach out. I love talking about this stuff. I am heading into my second cesarean. It's going to be a planned one in March 2020. And believe me, I'm practicing what I preach, and I'm here with you and support you, and definitely know what it feels like to have such a transformation to your body and to have to go through major abdominal surgery to give birth and have to heal from that too. So I have a program coming out soon, Heal Your Scar to Restore Your Core. Stay tuned for that. I will be posting more information about that in the next coming weeks. I am very excited about it. It's a manual all about scar massage and about your scar, and then a full video on how to actually do your own scar massage. So if you're not local to any massage therapists or pelvic physios, I will guide you through doing your own massage to help relieve any discomfort or restrictions within that tissue in there. All right, everyone, have a great night. Thank you all for joining me, and I will see you next week.